So good morning, everybody. Thank you all so much for being here for our final session of our Foundational Community Supports Golden Thread of Documentation training. And today, to round out the golden thread, we're going to talk about providing and documenting services. So we're going to talk a little bit about something called intentional services, which I'm going to give you all a little bit of a definition and kind of what intentional services are. And then we're going to speak specifically about progress notes, how to develop progress notes, and how to, what should be included in progress notes. So I'm going to ask everybody, I have it set so that everybody is muted upon entering. So I am going to ask that unless you have a question, please make sure that you do keep yourself muted just to minimize any background noise. And I'll just put the call-in information in the chat box in case anybody needs it. It does look like most, if not everybody, is connected to audio, but if you do need to connect to audio, the call-in information is there. I do want to give a shout out to Washington State Healthcare Authority. Washington State Healthcare Authority is sponsoring these trainings. And we've prepared for you an interactive training. I know I've gone through this spiel 5 times, but I'll just do it one last time. So we are going to make the training interactive and engaging. There aren't going to be any breakout groups today, but I am going to ask that people do give us your feedback in the chat box, because you don't want to hear me talk for the next hour and so many minutes. So whatever dialogue and information you can contribute to the conversation is very much helpful, and it helps. We're all learning together here, right? We're all helping each other learn. So your feedback and input is incredibly important. Earl, if you could put the PowerPoint slides for today in the chat box. And at some point after the training today, the recording and the slides will also be sent out by Washington State. Okay. So just to give everybody some of those basics, or I'll put the call-in information in the chat box if you need to call in. Please do keep yourself muted unless you have a question. If you do have a question, feel free to unmute yourself and chat with me freely. Sometimes it can be a little bit easier to say things as opposed to typing them in the chat box. You can choose to have your video on or off in this meeting, but we do ask that if you do decide to have your video on, that you are making sure that your background and dress are appropriate. We might mute your audio or video at any time if we need to. We're not doing so to be rude. We're just doing so because if there's a lot of audio, we might mute you. If something potentially inappropriate is happening on your video, sometimes people's videos accidentally turn on and things are happening, we might need to mute your video. To ask or respond to a question, use the chat. You can also raise your hand if you would like to unmute yourself. And then we are recording, and the recording is going to be sent out by Washington State after the training. So this is our overview. And like I said, we're at our last meeting today, which is providing and documenting services. I am Emily Vans. I am the facilitator of today's training. You all should know a little bit about me if you've participated in some of our other trainings. But I will say that I currently am a lecturer here in the Department of Psychiatric Rehabilitation and Counseling Professions here at Rutgers School of Health Professions. Prior to that, though, I did work in the field. I did work in supportive housing out here in New Jersey. So I know, I don't just know what I'm talking about, I've actually practiced what I'm talking about as well. So we're just going to really quickly go over the learning application. So last week we talked about interventions. And one of the main interventions we talked about was skills teaching. So we asked for everybody to plan and teach a skill using the skills teaching template. So I'm going to ask first and foremost, was anybody here able to use the skills teaching template to practice a skill? And you can just, or to teach a skill, I should say. And you can give me a yes or a no in the chat box. Okay, so I'm getting some no's. Did anybody here get to use just tell, show, do in order to teach a skill? And tell, show, do is kind of like that reduced version of skills teaching where you talk about the skill and tell them about the skill, talk about the steps, you show and model how to do those steps, and then you ask the person to utilize the steps. Okay, so Glenda, you did use tell, show, do. Well, that's fantastic, Henry. So it sounds like it might be something you can use in the future. You haven't had the chance yet. Steph, with grocery shopping, fantastic. So for those of you who were able to do tell, show, do, what was your experience like? Steph, you said you did with grocery shopping. Glenda, you said yes. So what, if you can give us and elaborate a little bit, what worked well or what was challenging? Was there anything challenging? And I'll give, oh, thank you, Steph. So client was nervous and didn't want to do it at first, but after a few attempts, it became fun for him. And the last time we did it together, he was proud of himself. That's really fantastic, Steph. It sounds like overall you had a really good experience and that it went well. And regarding challenges, excuse me, including challenges, self-confidence, and time, right? So depending on the skill, and I'm happy you bring up time, right? Sometimes there isn't a lot of time, or sometimes the skill really, in order to really go through this process, you need a lot of time that maybe you don't have or the person doesn't have. So I think it was really great that you brought that up, Steph. Thank you. Okay, Glenda, you work by Zoom. So that can be very hard teaching skills on Zoom. But you said this week you'll be in person. I'm looking forward to be able to demonstrate with the person in person. So that's fantastic. And it can be very challenging to have to teach a skill over the internet. I know the providers here in New Jersey experienced that very early on in the pandemic. And something that we suggested, and I'm not sure if this would be helpful for you, Glenda, or anybody else that does work virtually, is if you feel comfortable, one of the, I guess, ways one of the things that our department kind of came up with to support workers in teaching skills through like Zoom or virtually, we'll say, is to record a video of yourself doing the skill and then sending it to the person to view if you feel comfortable, if you have the environment to do so, just so that they then have that on video and they can refer back to it. And that's kind of the showing part. And that could be a little bit more helpful because sometimes there's a lot of trial and error when you're doing things virtually, like quote unquote in person. So that's just a suggestion, is maybe either recording yourself or have somebody record you, or again, just using a YouTube video like we talked about last week. So I don't want to spend too much time on this, but I appreciate you, Glenda and Steph, for chiming in on this. But I want to switch gears and get into what we're going to talk about today. So we're going to talk a little bit about the stages of change and look at how the stages of change can impact the intervention process, the development of the interventions, what you should consider when you are developing a service plan to ensure that the stages of change are something you should consider when developing interventions. So we're just going to make a very quick connection with that, because I know we talked about the stages of change a couple of weeks ago. We're also going to talk a lot about intentional services and how we can all provide intentional services. And then we're going to shift to documentation and how to document consumers' progress. And we're going to apply the components of the DAP format to a progress note. Now, I know that a lot of agencies use different types of progress notes formats. I've heard of SOAP, DAP, DAPE, DARP. There's another one I think I heard of, but we're going to focus specifically on DAP today. Obviously, do whatever your agency is directing you to do in terms of how to document your progress notes, but hopefully there's some information that's helpful to you that I'm going to be able to give you today. So we've gone through the golden thread. Okay, we went through that engagement process. We assessed medical necessity. We looked at assessing strengths and needs. We looked at the identification of personal goals. We developed that ISP. And now that we have that ISP, we're going to provide those services. Once those services are provided, we're going to document them and ensure that the services tie back to the plan and the services tie back to the assessment. So this is going to be us completing this golden thread of documentation today. Now, this slide is going to look a little bit familiar to you, right? Because we talked about this the other day, so I'm not going to spend too much in depth on this, but we want to always consider the stages of change when developing interventions, okay? When determining how you can best support the person that you're working with, you want to ensure that the intervention is in alignment with the person's stage of change. And this is especially important because stages of change are fluid. So somebody can literally be in a pre-contemplation or contemplation stage 1 week, transition into an action-based stage of change, and then potentially go back into pre-contemplation. Because life happens, right? Things happen in life, situations arise, our priorities change, our mindset shifts. So you have to be mindful of that when you're developing the ISP and ensuring that you're accounting for that stage of change, okay? You also want to make sure that the stage of change is in alignment with the person's, with each of the person's goals, okay? Someone can be in an action stage of change for one goal and then be in a pre-contemplation stage of change for a different goal. It really just depends on where the person is at. So you want to make sure that if someone's in action and you're developing action-based interventions for one goal and they're not in action for the other goal, that the interventions are in alignment with whatever stage of change they're in for that other goal. Okay. And then again, your interventions on the ISP, should be determined by what stage of change the person is in for that goal, okay? And these are all the stages of change and the different interventions that are the different interventions that are aligned with that stage of change, okay? And I really want to highlight that contemplation and preparation have a lot of education and motivational interventions, right? So that's when you're giving information to the person. That's when you're using your MI skills. You're talking about and kind of processing the person's ambivalence, right? Once you get to action, that's when the person's going to be able to, that's when you're going to be able to utilize interventions based around skill building and cognitive behavioral interventions, okay? If you try to do skill building or cognitive behavioral intervention with somebody in contemplation or preparation, it's probably not going to work because the motivation isn't there. The person's just not, there's not enough buy-in, right? So you want to make sure that if you are using skill building and cognitive behavioral interventions, that you're being mindful that the person is in an action-based stage of change, okay? So Henry, and I'll go back for a second. So maintenance goes back to pre-contemplation just to kind of drive home the point that the stages are fluid. Because you could be at maintenance for a goal and you can go back to pre-contemplation. Just because somebody is in maintenance for a goal doesn't mean that they're going to stay in maintenance for the rest of their life or for the rest of the time that they're working on that goal. It just kind of depends. Yeah, very much the fluidity. Yep. Okay. Now, when you're working with and using stage-based interventions, okay, the individual is going to be more willing to take steps to work toward the goal because there's that alignment there. However, if there's an incorrect stage of change, the interventions are going to be misaligned with an individual's motivation. Okay, so if we go back to this idea of using skill building, okay, to be in skill building and to use skill building as an intervention, the person should be in action. If they're not in action, they're not going to have the motivation in order to work on that intervention, to work on that skill building. That's going to result in the individual's inability or unwillingness to work on the intervention. So something to kind of consider when you're thinking about interventions and whether or not they're aligned with the person. If you develop a service plan and you go out and meet with that person and they're like, oh, I don't know, I don't want to work on this, or, oh, I don't know, I'm kind of worried about working on this. That's going to be like, that's like a red flag, not a red flag. That's like a bullhorn in your ear, like danger, danger, maybe not necessarily danger, but something's not going on, right? Something's not aligning there, right? That should be an indicator to you that maybe I should think about whether or not this intervention is at the person's stage of change. Is there an alignment there? And what's going to happen is if you continue to keep trying to work on this intervention with the person and the person keeps like saying like, no, we'll work on it, it's okay. But then they're not going to work on it. It's just going to end up in a lot of frustration for you and the person. Okay. That person's inability and unwillingness should cause a pause on your part to really think about what's going on. Is it the stage of change? Is it symptoms? Is it something else? It could be a lot of different reasons. It's not always going to be the stage of change, and that's not what I'm trying to say. But if this is kind of what you're hearing from the person, or if you're still hearing that ambivalence about working toward the goal, then it might be a good idea to go back and reassess and figure out whether or not you still want to have that intervention on the plan. Okay. So before I move forward into intentional services, I do just want to ask, does anybody have any questions about the stage-based interventions and why, any questions about the stages of change and intervention development? And if you have a question, please feel free to put it in the chat box. I'm happy to go back and answer it, okay? So now we're going to get into this provision of intentional services. But what does that mean? I'm going to tell you what it means. So intentional service delivery, very simply put, is purposeful, deliberate, and planned. Okay? So when you're providing Connie has a question. So I guess it's more of a comment, Connie, that sometimes people are too comfortable and don't want to make the changes sometimes for years. Well, yeah. If you're feeling comfortable, why would you want to do something so scary and make a change, right? But that comfortability could also just kind of sound like ambivalence. Right? It's that uncertainty of, oh, well, maybe I know I should make this change, but I don't know how, or I'm unsure about doing so, right? That sounds a little bit like ambivalence. And that's something that you as a staff person can use your motivational interviewing skills in order to help the person to move through that ambivalence and get to an action-based stage of change. So intentional services, you want to make sure that when you're going out and you're meeting with a person, that you're doing so with a purpose. You're doing so with an intention of, I'm going to meet with this person in order to do X, Y, and Z. Okay. And that's why intentional services are planned, right? Because you're going to have a little bit of forethought on what exactly it is you're going to go out and meet with the person for. And that's where that service plan comes into play. You're also making sure that those services are deliberate, right? That you're going out there and ensuring that the services are provided in a way that is based off of that IRP or ISP, I should say. Sorry, it's IRP in New Jersey, but that they're based off of the ISP and you're doing so in this purposeful way. Okay. So basically 3 words that all mean similar things, but that's really what intentional services are. So I want to ask a question and just kind of put this out there. How do you all provide intentional services? Do you all feel like you're providing intentional services right now? What are you guys thinking? Give me a yes if you're providing intentional services and no if you don't think you are. So Alexander, you said, I feel we are now. I would say a few years ago, we weren't as well trained with it being as client driven. Absolutely, Alexander. And I can say that that is 100% mirrored out here in New Jersey. When we shifted to our Medicaid fee-for-service model prior to that, we weren't really providing intentional services. Okay, Connie, for some program aspects, yes, other program aspects, not as much. And yeah, sometimes things happen, right? A crisis happens, an emergency happens. That's not on the ISP, right? So there are going to be times where you have to be a little bit more flexible. But Corey, it sounds like your services are directly related to the goals. So that means that you are providing those intentional services. Daya, if I pronounce that incorrectly, let me know. But it sounds like your agency is starting to. Okay, so Steph, sometimes for you, it's very much dependent on that on the stage of change that the person's at. And yeah, it can be difficult, Madeline, absolutely. So Madeline, you said in your agency, we almost don't get time to plan intentional services. So one thing I would suggest, Madeline, is to make sure that, intentional services starts out with that service plan. That's going to be that guide. The service plan is probably like a recipe. When you're going to cook something new, you need a guide. You need to know what exactly it is you're going to do, right? So the service plan is that recipe. It has all the ingredients on it. It has all those knowledge, skills, and resources that we talked about. And then it has those steps. And that's where the goals, objectives, and interventions are. Okay. All right. So a little bit about intentional services, right? So when you're providing intentional services, most services, okay, awesome, Madeline. So it sounds like your agency is working to try to mitigate that issue by making sure that the ISP is more provider friendly. So that's fantastic. I'm happy that you have the support of your agency. Because that's challenging when you notice an issue and, supervisors maybe aren't being supportive. So that's good to hear. So I say most services delivered should be on the ISP because we know that things happen. Right? We know that a crisis can occur. We know that an emergency situation can occur. There's a lot of things that can occur because such is life, right? So most services delivered should be on the ISP, but we also understand it's not going to be all services, okay? Part of that intentional service delivery is planning what will be provided during the visit, okay? So obviously things are going to come up and you might have to be a little bit flexible, but if you can, prior to going out and meeting with the person, maybe getting an idea with them, if you're giving them a phone call, hey, I'm coming by at 11 o'clock today, can you tell me which goal you wanted to work on? Or which objective or that you wanted to work on, right? So then you can go to that intervention on the ISP and figure out what you're going to bring. Now, luckily, we're living in a very different time than we were even living in 10 years ago. Because when I was working in the field 10 years ago, even, we had to print worksheets out before going to the outreaches. We only just started having smartphones I don't even know if I had an iPhone. If I did, it was probably a very early. Does anyone remember BlackBerry? I'm not even going to get into this, but it was a very different time, technology wise, than we have now. So now, if you go and meet with the person and they're like, no, I don't want to work on that goal, you can go in and you can look at the ISP and maybe pull up some information related to the other goal and that related to the other intervention, right? You can kind of do those things on the fly. Whereas like back 10 years ago, when I was going out to meet with somebody, if they said they wanted to work on nutrition and I had all this information on nutrition and they said, nope, I don't want to work on nutrition, I was kind of in trouble a little bit. Now you can kind of pull things up. What I do recommend is when you find like a really good article or a really good piece of information that you want to give to somebody, bookmark it. Bookmark it on your computer, bookmark it on your phone, save those websites so that you have that information in kind of like a online digital filing cabinet, so that when you go out and meet with the person, you can provide them with that information and then either email it to them or maybe bring them a handout the next time you see them. But all of that kind of goes into the planning process, right? Having an idea of what exactly it is you're going to work on with the person, the different resources you need in order to work on it with them, and then having those resources available. And Savannah, I don't even remember what BlackBerry I had. I just remember BBM, BlackBerry Messenger. It was the whole thing. But yeah, technology was very different 10 years ago. We're definitely in a much better place technology-wise. And then you want to make sure that, or no, we're not going to make sure. Let me backtrack for a second. So intentional service delivery does not mean that services other than those identified and the ISP cannot be provided, right? When you are providing intentional services, you can provide those other services not provided on the ISP, like crisis intervention or, documenting another type of emergency. You just want to make sure you document it, right? You want to make sure that when you're writing your progress note, you're documenting that you went out to meet with the person for this specific purpose. However, when you arrived, it was determined that consumers' heat was turned off, or that they received an eviction notice, or that their symptoms are currently exacerbated, and the meeting needed to be shifted toward reviewing coping skills, right? You want to make sure you're providing a rationale as to why that shift is happening. However, if those other services are provided more frequently, you might want to modify your ISP. So if you're going out and meeting with the person and multiple times you're having to shift to this other goal, maybe that the person has that maybe isn't on the ISP, you might want to modify the plan and add that goal in. There's no hard and fast rule here in terms of like, if you see the person 2 or 3 times, then you should modify the ISP. That's really going to be dependent on your agency. But if it's happening often, it might be something to consider. We also have some benefits of intentional services. And this is something that I think someone alluded to, or I think I'm going to address what someone kind of alluded to a little bit earlier, in the sense that intentional services give you more of the plan driving service provision, and the service provision having more of a specific and intended outcome. Because you're there with a purpose, it is, it can be assumed that when you're going and meeting with the person to work on this goal, that they're going to potentially achieve this goal, right? That's the intended outcome. Because of that, you're going to have less of this following up with and checking up on. And that's what was happening a lot out here in New Jersey. We did a lot of following up on, we did a lot of checking up on. We had individuals who had the same goals for 5, 6, 8 years. And, people were in a place where they were feeling stagnant. And it was a hard shift when we shifted to fee for service, but I think it was something that people were really grateful for because they were really working toward their goals. So intentional services 100% has some benefits, and it's, at the end of the day, it's helpful and supportive to the individuals that you're working with. So an example of a purposeful visit. So instead of going to check in on Bob, what's an example of a purposeful visit for Bob? Just throw anything out there. I know we don't know Bob, we don't know his goals, we don't know anything, but what could potentially be an example of providing a purposeful visit to Bob? So Steph, you said going to follow up with Bob to see how something went. Yeah, potentially. There you go, Connie, right? Helping him find food resources, food banks, meal sites, mobile pantries, signing up for food stamps. Taking him out for shopping or supporting daily needs, meaning to set a goal and what the plan would be to be successful of that goal. So Mary, you said bringing him a coffee because you are in the area. Are you saying that's an example of a purposeful visit?
And checking in. Oh, I'm not sure if you can hear me. I took my headset.
Yeah.
Checking on Bob. I do currently have a client that does not like to talk about business or goals or what have you. So I kind of have to make little excuses. And so I'll pop in with, hey, I just so happened to be in the area. I wanted to see how you were, and then turn that into a reason for visit. And then we just sit and chat about how things went out through the week past. So for me, that's definitely, there's a purpose for my visit. He just doesn't like the paperwork type stuff. He says it puts him at a lower level than me. So I just kind of make it equal by, hey, I just happened to be in the area and thought I'd stop by and see how you were doing type thing. And so, yeah, it works for me.
Well, it sounds like though going for coffee though, or bringing him coffee isn't actually the purpose though, right? No. The purpose is to meet with them for a specific reason. Yes. It's just your engagement with the person involves bringing coffee or a donut or something along those lines.
Yeah.
So that would be more of the example, right? So meeting with him to work on such and such thing by using this engagement strategy.
Okay, I can see that.
Yeah. Because I'm going to tell you something, Mary. If you put in the progress note that you went to meet with them for the coffee, then that sounds kind of like it's the outreach, right? Like that's the service you're providing. But it sounds like you're providing so much more than that. So you always want to make sure that you're documenting all those other things that you're doing and not just highlighting the coffee piece.
Definitely. Thank you.
No problem. Thank you for sharing. Where was I? So Madeline, you said seeing what Bob's current status is with housing or employment, seeing what next steps might want to be, and what the next meeting might look like, giving information or direction of what you have researched or guide him to help. Absolutely, right? All of these are examples of purposeful visits, right? So the example I have is Bob and I are going to review how he is settling into his new apartment, and we'll review and practice the coping skills I taught him last week. Right? That's a purposeful visit. That's a clear description of what actually is happening when you meet with him. Same thing for something like dropping off Mary's meds, right? It's now shifted to Mary wants to discuss taking fewer medications. So we're outlining questions for her to discuss with her doctor next week, right? So you're being more clear and concise about what you're doing and ensuring that what you're doing is based off that service plan and that it is in alignment with what the person's goals are. Okay. So we're going to do a quick practice. Okay. So Ralph is a 30-year-old male who has been diagnosed with bipolar disorder since his early 20s. He lived on his own in his early 20s. However, he was evicted from his apartment within a year and began living with family. Ralph is close with his parents who have been supportive of him. But after discussing their living situation together, Ralph decided that he wanted to try living on his own again. He states he's ready and looking forward to his new independence, but also finds the process to be daunting, and his symptoms of depression have increased due to stress. Okay. So, in the next 3 months, I will find an apartment within walking distance of my parents' home while learning ways to manage symptoms of my bipolar disorder. Okay, so this is this service plan that was developed. So my question for all of you is take a second to kind of review the service plan, and how might you provide an intentional service to Ralph? So pick an intervention and tell me a little bit about how you would go out and meet with Ralph to provide that intervention to him. I'll give everybody another couple of seconds. So Luann, you said you like intervention one, which is the staff person will meet with Ralph 4 times for 60 minutes to identify his preferences and barriers related to successful tenancy, including collecting information on identifying housing retention barriers. So if you were going out to meet with Ralph for intervention one, though, how would you do so? How would you have that conversation with him to identify his preferences and barriers related to successful tenancy? How would you start that conversation off? So Connie, it looks like maybe you're talking about intervention 3, which is to attend education and training sessions on the role, rights, and responsibilities of the tenant and landlord. And it looks like you would kind of start at the worst case scenario, or kind of like at the end of it, right? So focusing on that eviction process, making sure it doesn't create its own barriers. For example, did he owe money to the former landlord that needed to be paid off? Did the eviction go to court? And if so, likely to come up and on a background check? Could he take a responsible renter's course to mitigate the effects of the eviction? So it sounds like, in terms of like educating him, really focusing on what some of the challenges were in the past, and kind of looking at some of his past experiences with living on his own and seeing how those could potentially be solved or resolved before moving into a new home. So Patrick, you said seeing that he's experiencing symptoms, you would ask if he could meet with me and the local Center for Independent Living support providers to see about community resources that could help provide a better quality of life, as well as provide services which could make his apartment finding a little better, and a living better experience for all parties involved. Yeah, so it sounds like giving some linkages to different resources in the community. That sounds perfect. Luann, you said start by identifying his ideal housing preference and barriers to achieve goal from there. Timothy, you said try to concentrate on his readiness. So this will bring more stress on him because he is going to be evicted. So I think that's a really great place to start, Timothy, right? So where's his readiness at? Is he in a place where he's feeling like he's able to and wanting to live on his own? And what does that look like? And then Alexander, you said it sounds like it's been at least 7 years since his eviction too. If he's 30 and the eviction happened in his early 20s, it shouldn't be on his record at that point. That's a great point, Alexander, right? So some really good examples of how to provide those intentional services to Ralph, linking in some community resources, meeting to go over and have a conversation and open up some dialogue. Staff, you said meeting with Ralph to discuss what his preferences are by providing examples of what might be possible and provide photos of options, discuss his options if available for Section 8 or clean and sober housing, create a sub goal to address barriers, not having ID documents and working to get him those documents. Absolutely, Steph. And that's like 5 interventions right there. That's like 5 outreaches you have just for the first intervention, right? Or one outreach that at least is a couple of hours, because there's a lot of little things that go into each of these interventions, right? So there are going to be little tasks that are going to go into each of these. And that's what you really want to consider when thinking about an intervention, because the intervention is that guide, right? It's the guide. But when you look at a recipe for a specific dish that you're going to make, it doesn't tell you to put the oven mitts on before you take the dish out of the oven, right? But that's just something you have to do in order to make sure that you're safe and that you don't get, 80-degree burns on your hands, right? So there are other things, even though this ISP is the guide and the interventions are going to tell you what to do, there are going to be these little tasks that are going to come up that are going to all funnel into these interventions. And then Madeline, you said a mix between 1 and 3, during 1, really trying to get those preferences. How much can you afford? What information do you need? What was your last experience like? Why? And then also getting some of those trainings if you would be interested. And also, it sounds like with this process, and this is just something to think about, I don't know if this is something any of you are already doing, but also thinking about like how to kind of organize all this information. Is the person a visual learner? Is it, somebody mentioned pictures and using photos. I think that was you, Steph, right? So really looking at the person's learning style and thinking about how all this information that you guys are going over and talking about is being organized. Is it on paper? Is it written down? Is it being formatted in another way, right? So we're about 12 minutes away from being at the hour mark. But I know everybody is going to want a break. So I'm going to give us a break now. We'll take 3 minutes. So we'll come back at 1:21. Okay. Yep, because it's 1:19. I figured that would happen. So we'll come back at about 1:21. I'm just going to pause the recording and we'll take, not one. Oh no, hold on. Pause. 10:21. Okay, I corrected myself. We're going to come back at 10:21. And then we're going to kind of shift gears and then go into this documentation. Okay, so take 3 minutes. We'll come back at 10:21 and I'm going to pause the recording. Thank you, Earl. All right. So let's get back into this. So we talked about providing intentional services, why we provide intentional services, what that looks like, how we go about doing that. And now that we've provided these services, we have to document them, right? And that is the final piece of this golden thread of FCS process. And I would argue probably the most important piece. When Medicaid or the state of Washington, if the state of Washington does this, I suspect they might, when they come out and audit and review your charts, they're definitely looking at the assessment. They're definitely looking at the plan, but they're also looking at the progress note. And when you think of the progress note, especially from the lens of Medicaid, that's your bill or your receipt, or their receipt, I should say. That's what's showing them that they authorize this amount of service for you. You billed this amount of service. And this is the progress note that verifies that you actually did provide the service. How many of you out there have heard the terminology or the saying, the phrase, if you didn't document it, it didn't happen? Has anybody heard of that? It's on your binder, Jerry. Yeah. Yeah, because it's true. It's a true statement, right? So you may have gone out and you may have met with Ralph for as many times as you requested, and you might have followed the assessment and you might have followed the plan, and you might have, done everything to the T. But if your documentation, if your progress note does not actually reflect that, if it is not connected, Medicaid's not going to see that, right? So that's why it's very important to do such a thing. If we go back to those examples of purposeful visits, if you're documenting that you went out to pick up Mary's or to drop off Mary's medication to her, and that's how you're documenting it in the progress note, but that service is not on the plan, and you're doing that every single week, Medicaid's not gonna be happy with that. I don't want to say they're going to take back money. They might take back money. I don't know. I'm not a Medicaid auditor. But if you're actually going out and meeting with Mary and providing medication education or, assessing symptoms and, determining ways and habits for Mary to go and actually take her medication, right? And that's what you're actually doing. But your progress note is only reflecting the dropping off of medication. There's a misalignment there, okay? And that's something you want to be very careful about. You want to make sure that the services that you're providing are being documented as such, okay? And we do that through documenting progress notes, right? Through documenting the services you're providing, okay? So when you're documenting the individual's progress and the progress that they're making through the services you're providing, you want to make sure that first and foremost, you're documenting every encounter, right? Some type of piece of documentation needs to be in the individual's chart for every single time you meet with them, or as we said earlier, it didn't happen, okay? You also want to make sure that you are emphasizing and putting information in there about the progress that was made or the progress that wasn't made and why it wasn't made, okay? So you want to make sure that you're documenting that, so-and-so is making progress on their goal due to X, Y, and Z factors, okay? So Earl is making progress on his goal towards losing 15 pounds by utilizing the different resources given to him by staff, or by participating in exercise, by taking the nutrition class, by working with his doctor, by such and such thing related to what service you're providing to him, okay? You also want to make sure that that documentation is describing the different interventions provided and what their outcome is, right? So if there's an intervention on the ISP and it's not working, that's okay. You are 100% allowed to try something else, right? So want to make sure that when you're providing that intervention, it is described in the progress note, and that the outcome of whether it's working or not working is also documented. And then finally, you want to make sure it has adequate content dependent on the services provided. So if you're meeting with the person, or let me ask you all this, what's the longest amount of time you've met with an individual? Like, are your outreaches normally an hour, or they're normally 30 minutes, an hour and a half? What's the amount of time you're normally meeting with people for? Natasha said 1 to 2 hours. Normally an hour, 2 to 3 hours, normally an hour. Steph, 5 hours. That's a lot. 90 minutes, an hour max. 5 hours is your longest, normally 1 to 2 hours, 1 to 2 hours, but I've had up to 6. Okay, Madeline, yours is 1 hour due to billing, about an hour. Hour usually for employment, it's 15 minutes for billing. Yep. So if so I think the person who met the most with somebody was 6 hours. I want to say, sorry, Steph, Timothy has you beat with 6 hours. But now, Timothy, when you think about how long the progress note was that you documented, I'm not going to try to figure out how long it was, but I am going to say that it probably was not just 2 or 3 sentences. Right. And that's what you really want to be mindful of, right? You want to make sure that you're encompassing everything that happened in a very clear, concise, and succinct way. But nobody can tell me that you can provide a 6-hour outreach to somebody and clearly and concisely and succinctly document that in 3 sentences. I don't think anybody's capable of doing that, even the best writer out there, right? So you want to make sure that if you're meeting with somebody for an hour, 2 hours, 3 hours, that there's enough content in the progress note to basically tell the reader, in our case, Medicaid, what happened and why what happened makes sense, or is why what happened for that hour or 2 hours. Okay. So if you're meeting with somebody for 3 hours, and again, there's 1 to 2 sentences, it's probably not enough information. Okay. So you just want to make sure you're being very, very mindful of that. Again, there's no hard and fast rule. There's no hard and fast rule. I wish there was. The data section of the progress note should be 5 to 6 sentences. There's no hard and fast rule there, but you want to make sure that you are encompassing everything that happened to the best of your ability. Okay. There's my mouse. So these are the different required elements of a progress note. Okay. So this is all information that should be in a progress note. So that's a really good point, Connie. Yes, there are no, unfortunately, magical progress note elves that write your progress notes for you. As much as I wish there were, this is not Harry Potter. There are no house elves. If anybody understood that reference, I salute you. So you also, and a big part of this, and I'm happy you do bring this up, Connie, is making sure that you have the time to document, right? Thank you, Patrick. So building in time is a great suggestion, and I definitely suggest everybody highlight this, making sure that, if you're meeting with somebody for an hour, maybe adding that half hour in for documentation. The other thing I'll ask really quick, because this is definitely relevant to documentation, before I get into these required elements, is, has anybody here heard of concurrent documentation? So Anita, you said no. Patrick, you have. That is not the, not really, Luann, but it does have to do with the individual you're working with. All right, so concurrent documentation is when you complete the progress note during the meeting. Krista, ding, 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 you got it. If I had a piece of candy, I would throw it at you for getting that question right. Yes. So it's when you, see, that used to be the fun thing about in-person trainings. Unfortunately, if I tried to throw chocolate to you, Krista, it would probably take a couple of days to get there because I would need like express shipping because I can't throw all the way to Washington State. So when you are doing concurrent documentation, you're documenting within the meeting. And we've kind of heard some mixed messages on this. This is definitely something we highlight and we suggest to our providers out here in New Jersey. It's really up to your agency on whether or not this is something that is allowable within your agency. And yeah, and I'm happy you bring that up. Well, Beverly, why doesn't it lend itself to MI? I wonder about that. But I'm happy, Valerie, you brought up medical appointments, and maybe this will explain it, Beverly, right? But when you have a medical appointment and you're sitting there at the doctor, with the doctor, and the doctor is like this, typing away, yeah. We don't want to do that. That's not what we want to do, right? So that's why, and that's what we're thinking, Beverly. So I'm happy we're on the same page. What you want to do is, and how you can do concurrent documentation successfully, is not to have your laptop out throughout the whole meeting, but to take 5 to 10 minutes at the end of the session to document. Okay, so it's not like you're meeting with the person and the whole time you're typing away and making bullet points and things like that. What you're doing is you're taking the last 5 to 10 minutes and saying, hey, I just kind of want to go over a little bit what we talked about today. And just putting in a couple of bullet points or just some important information. Can you tell me about what we talked about today? Can you tell me about what you learned from me today? Can you describe what our session was like today? Right? Because you're getting the person's response to the intervention, right? You're getting that information directly from their mouth, right? You're getting it from them, how they responded to the intervention. Like, I didn't really like that information you gave me. It was kind of confusing. It would have helped if you gave me something else, right? And I'm happy that they face you, Valerie, because I've had many a doctor just like typing away from me. But that's a really good way to do concurrent documentation, because you're kind of fulfilling both needs there. You can still focus on the person, but you're doing so in a respectful way because you're engaging them in the conversation. No problem, Alexander. Thank you. So that is an option for all of you out there to try out if you would like to try out concurrent documentation. Again, it really is dependent on your agency. But going back to going all the way up, Connie, going back to Connie, what you said, that could potentially be something to suggest to your staff in terms of doing concurrent documentation, if that's something that your agency allows. So the other thing I'll talk about really quick before I get into these required elements of a progress note is something else that I've had people suggest is to do like talk to text. So emailing yourself, and you know, doing the well, what about HIPAA, Valerie? Like HIPAA regarding talk to text? Because using talk. So what I meant is opening up your email. So if you have your email on your phone, and as if you were typing an email using, or even on your phone. I can open up my email for my work, which is encrypted, and I can use the speaker function on my phone to talk into it, and it'll type out an email for me just by speaking it. So the verbally what I'm saying, yes, as long as the email is protected, yes. But no, I'm not suggesting just texting anybody information about a progress note. That's not what I was trying to say. But something that you can do is speak the information into your phone. The other thing about it is, as long as you're not putting any identifiable information in there, it's not a HIPAA violation. So as long as you're not mentioning the individual's name, their date of birth, their diagnosis, all those things, you could still potentially use an unencrypted email. But I always suggest people use their work email because usually that's encrypted. But that's just an easier way to be able to try to get the note done and try to get some of your thoughts down while it's still fresh in your head. Okay. Yes, absolutely. Technology, right? Use it to our advantage. That was actually something that a supervisor suggested to me. And then there are programs out there like Dragon that, you know, if you're able to get that and purchase that, that's also something you could use. Okay, so just some very relevant information around progress note writing that hopefully was helpful to all of you. But now let's get back into these elements, okay? So this is kind of what progress notes should include. This is the different type of information. Now, this is the very basic information that a progress note should include, okay? Your agency might have you include more, but at the very least, the goals addressed during the visit from the ISP should be in there. The different interventions provided, where the services were provided, how long that they were provided for, the person's response, the plan, and your signature, including your title and credential, should be here. Should be in the progress note, I'll say. And again, this is just the very minimum. Does all of this information look familiar to everybody? Yes? Okay. Good, good, good. Do any of your agencies ask that you add more additional information? Anything that's listed on, anything that's not listed on here? What kind of information is that you need to add per your progress notes? Kristen, when you say form of interaction, can you clarify what you mean? Okay, face-to-face versus phone call. Yeah, absolutely. That could very well be something. And a lot of billing systems want that, I believe. So Steph, their strengths and whether or not suicidal ideation or homicidal ideation were present. Angela, you said yours asked for your story that is relevant. So some other information. What contract the work is under. Okay, so that's like a billing thing. What their status is. Yes. So there's a lot of, and I'm seeing some overlap, and I don't know if that's because some of you maybe work at the same agencies or not. But again, this is the bare minimum, and your agency will 100% build off of this. But this is what Medicaid is looking for. This is what a Medicaid auditor is looking for when they come out and they review your progress notes, okay? They're making sure that all of this information is included in there. Now, as I said earlier, there are many, many ways, and absolutely, Ben, right? Different programs have different needs. And it's great that you bring that up because part of that's going to have to do with your contract. Right. So if you have in New Jersey, we have something called medically enhanced supportive housing. And the individuals in medically enhanced supportive housing are people that are diagnosed co-occurringly with, excuse me, yes, Joyce, a medical diagnosis as well as a mental health diagnosis. So in medically enhanced supportive housing, as I'm sure you may have guessed, there is a little bit more emphasis on talking about the individual's medical needs, right? And what medical interventions were addressed within that outreach as well. So it really does depend on different programs. If you have a program that is based around like families, that could have different needs in terms of, if you have minors, there could potentially be different documentation needs. So I appreciate you bringing that up, Ben. Listen, Ben, I don't think I have that bad of a New Jersey accent because I don't say Joyzy. But I don't know. You guys could tell me. I know I have an accent. I know I definitely do. I think when I was out in Washington State, somebody actually said that to me. But I've heard some worse New Jersey accents. I really have. I think that's the first time that Earl and I have been doing this where someone has mentioned accents. Earl, I don't know. I don't remember. That's funny. Yeah. But I've been here. I am very, no, we don't talk like that, Ben. And I am very proud of where I am. I'm born and raised in New Jersey, so I'm very happy. But let's get back to DAP. So as I was saying, there's many, many different formats. What I'm going to ask all of you is, what format do you all use to write your progress notes? We're going to talk about DAP. As I said, I've heard of DARP. I've heard of DAPE. We've talked about SOAP here in these trainings before. But what type of format for progress notes do you all use? So Credible is your electronic health record, Angela. And I know that because agencies out here in New Jersey use Credible. Okay, so Patrick, you guys make an Excel sheet. Julia, you got to tell me what GURP is. Oh, that actually makes a lot of sense, Julia. Thank you, Krista. All right, so I'm getting a lot of, Earl, you gotta write that down someplace, Earl. GURP. I don't know if that's been talked about here before. That's interesting. So DARP, GURP. Okay, so we're gonna talk about DAP, which is a little bit like DARP. And I would also argue a little bit like GURP. So DAP is, where's my mouse? Data Assessment Plan. Okay, very much a simplified version of DARP, which adds the response. And then we've also talked about DAPE, which is Data Assessment Plan Education, I think, with the specific educational tools that were provided. But we're going to talk about DAP, which focuses on very specific components like that should be included in the data section, the assessment section, and the plan section. And at the end of the day, you're going to see a lot of overlap between DARP and with the goal, intervention, response, and plan. Okay, I'm assuming that a lot of the information that is included in the goal piece is also kind of included in that data piece. Okay, but there's no hard and fast rule on what format of progress note writing you should utilize. It really is dependent upon your agency, okay, and the way in which you do this. So in looking at the data, okay, the data is going to talk about the specific service and intervention that was provided. It's going to ensure a clear connection to the related goals, objectives on the plan. And it's going to include who is there, where the service was provided, and the amount of time spent. So this is going to encompass a lot of that really basic information, right? So it could potentially sound like writer met with John in order to work on his goal of losing 15 pounds over the next 3 months. Writer and John worked on the objective of finding 3 different low impact exercises he can use using the internet. Writer and John used the internet in order to search on different websites to find a few different low impact exercises. The exercises focused on such and such thing, et cetera, so on and so forth. I'm going to give you an example of a progress note later, so I'm not going to go too in depth into that right now. But that's basically the gist of how it might sound like, okay? Goal, objective, intervention, and then focusing on who, where, and the amount of time spent. Okay. And here's the thing, some of this information might not actually be included in the like content of the progress note. In terms of the goal, objective, and intervention, some electronic health records will just display that information at the top of the note. How long you spent with the person, the duration might also be like a drop-down box that you click off, right? So you might not necessarily have to include that information in the content and text of the note, okay? Then we have the assessment. And the assessment is going to look at the consumer's response to the intervention, which is what the outcome was, right? Was the intervention successful or was it not successful? It's also going to assess the progress towards the ISP goals and objectives, right? So is there progress? What does that progress look like? Are there any barriers to that progress? And then it's going to talk about any assessment of change in consumer behavior. Now, our kind of what we train on is that an assessment of change in a consumer's behavior doesn't necessarily have to be addressed in every single progress note. However, some agencies require that. We have a lot of agencies out here in New Jersey that always want the person to comment and have a statement on whether the person was oriented ×3, what their dress looked like, what their cognitive orientation was like, were they experiencing any symptoms? Other agencies don't necessarily want that information, every single progress note. So what we kind of settled on is if there's a change, that's when you want to document it. So if you go out and meet with so-and-so, and normally they're very well dressed, if it's maybe they're always wearing makeup, maybe their hair is always done, and then you go out and meet with them and they're looking very disheveled, maybe they haven't bathed, maybe they just don't look well, you want to document that, okay? You want to document that change, and because you don't know what that change means. It might mean something, it might not mean something. Maybe the person had a bad day, maybe the person had a bad weekend. We don't know that, but you definitely want to document it if there is a change. However, if your agency is telling you to do something different, then you want to do that. Okay, so always go by what your agency is saying. And then finally, we have the plan. And the plan is what the staff and consumer next steps are, the date and time of the next service delivery, and then that's the plan. That's it. That's the gist of it. Okay, so the staff and consumer next steps, and then the date and time of the next service delivery. So on next outreach, writer will meet with consumer in order to do X, Y, and Z on Tuesday, December 13th at 4 p.m. Okay. So this is the gist of this. And very quickly, I want to give you a document, Earl, if you could put it in the chat box. A document that we developed and we provide to the individuals we work with out here, which is called the DAP checklist. And what I'm going to do is I'm going to stop sharing for a second because I want to go over this with all of you. So Earl just put the link in the chat box. And this is available for you to download. Nope. I think I put the wrong link in the thing, Earl, but that's okay. Give me a second. Nope, that's not it either. DAP checklist. Yes, Brittany, I know that that's the wrong link. Just give me 1 second. So there's the link in the chat box. And I'm going to bring this up so I can go over this very quickly with all of you. All right, so this is a Word document. And the reason why we give it to you in a Word document is because We want you to be able to add and subtract from this if needed, okay? Because again, this is just a guide. So if you need to add an R in there, or if you need to change any of the language, you can, okay? But this just goes over the main points you want to focus on when developing the progress note, okay? So the data, is it linked to a goal from the rehab plan? Was homework follow-up last reviewed? Were the staff-specific interventions noted? And what was the consumer's report? The assessment, are the consumer strengths and current or potential barriers assessed as they relate to the delivered intervention? Was the staff's understanding impression noted regarding the progress as it relates to the intervention? What does the staff observe regarding the consumer during service delivery? And then the information in the plan. There's also just some general notes here, right? So is it dated and signed with your credential? Is the consumer's name on the note spelled correctly? Is it strengths focused? Are there any abbreviations used, standardized and consistent? Would someone not familiar with this person be able to read this note and understand exactly what has occurred during the service delivery? And is there enough information to justify billable time? And this general checklist here is very much applicable to what Medicaid, some of the things Medicaid are going to be looking for. Not all of the things, but some of the things, right? Is it signed? Is there an appropriate credential? Is the name spelled on the note correctly, right? You always want to make sure that all of the consumer's information is correctly on the progress note. Does anybody here on your electronic health record, have you ever accidentally put on in the progress note that you met with somebody from 1 a.m. to 2 a.m.? Has that ever happened to anybody? So this is a problem in New Jersey. A lot of the providers here use Foothold. I don't know if you all are familiar with Foothold or awards. That's what a couple of providers out here in New Jersey use, and that was a consistent problem. That was actually something I used to do accidentally, because it would start at 12 a.m. and you had to change the hour and the minute, but you also had to change the AM and PM. So there are a lot of us that would just put 1 to 2. We met with the person at PM, but inadvertently you were putting AM. Now that's not a huge error, right? But if it's happening consistently, that's a problem. So that's something that you could potentially add into this checklist as a reminder to yourself if you know that that's something you're consistently doing. Making sure that any abbreviations are clear about what those abbreviations are, right? Making sure that someone not familiar with the person, making sure that they would be able to read the note and understand exactly what's happening. That is probably the most important, I won't say the most important things, but one of the most important things on this checklist, because that's what's going to happen when somebody from Medicaid comes out and audits, right? They're not going to know the person. They're only going to know the documentation. So you always want to make sure that when you are developing your documentation, that anybody could come in, read the progress note, and know exactly what it is that you did. Okay. So this is the checklist. Again, you can add things, you can delete things if needed. Maybe, you are consistently doing 1, 2, and 3 in data, and maybe you're forgetting about the consumer's report, right? So maybe that's the only one you want to add under data in the checklist, right? You can kind of personalize this and edit it to fit your needs. But it could potentially be helpful, especially if you're new in the field, you haven't been working a long time. It can potentially be helpful to have a checklist like this, even if it's just something that you keep on the bulletin board behind your desk, just to have to look at when you're writing progress notes. Okay. All right, so let me get back to the PowerPoint. So before we move forward, I want to ask, does anybody have any questions about progress notes as we start to kind of wrap things up and kind of get towards the end of our session. We have about 30 minutes left. Any questions?
I've got one.
Sure.
So I feel like in a lot of like my case notes, you know, I'm kind of like writing down like it's usually like in like an intake, I'm writing down like what is going on in a person's life. And, you know, even for the people that I'm doing, you know, like long-term case management, still, you know, like a lot of life events are happening. I'm trying to document them, and I just didn't quite see a place in the progress note, the elements of the progress note that would kind of fit in. And I don't, yeah.
So to answer that question, I would say that if the life event is impacting the person's mental health condition, if it's impacting their progress, if it's impacting, again, their affect, mood, or appearance, that information could go into the assessment. So, you know, if a life event, so I think it really depends on what the event is. And before I clarify, does what I said answer your question to some extent or no?
Yeah, it does. Yeah. Like if someone I'm working with gets evicted, and it totally is impacting their so they want to, like the example you've been using, like someone wants to lose 15 pounds but then they get evicted. It's like, well, that's gonna go on the assessment.
Right, absolutely, right. So that's going to go in the assessment, and then that might even be an event that might cause the service plan to be like modified or redeveloped, and then that would be documented in that progress note when you sit down and you do that, right? So, you know, if on Monday, if today you're meeting with somebody and they're like, oh, we got evicted, and you need to go out there and do another plan by the end of this week, on Friday, you meet with them to do the plan, and you would say, met with Earl in order to modify his service plan because he received word on Monday that he was going to be evicted by his apartment and his goals needed to be changed to reflect his current needs, like something like that.
Beautiful.
Okay, that makes sense. Cool. And then Brittany, to answer your question, you absolutely can note the stage of change in your notes. And I think that could go as well very much in the assessment, right? So because if the person's experiencing a lot of ambivalence towards working on a goal, that could be a current or a potential barrier, right? That when I was documenting notes using this format when I was working in supportive housing, I would say that was where I was documenting that. But it also depends on what and how your agency is formatting their progress notes. It could also go under an assessment as well around your understanding or impression regarding the consumer's progress, right, as it relates to delivered intervention. So, you know, individuals currently in a contemplation stage of change and experiencing a lot of ambivalence around working toward X, Y, and Z, et cetera, et cetera. So I hope that makes more sense and clarifies a little bit more. Does anybody else have any questions?
I have a question. This is Krista.
Sure.
So I always struggle with my service plan that's constantly changing with a person's goals. And then my notes obviously reflecting those goals. But is this something that I shouldn't just delete their old goals? I should just like add on and add to the document versus like deleting what was already there as goals?
So is the service plan like being modified? Like, are you sitting down and meeting with them and modifying the service plan?
So sometimes I sit down with them and modify it, or it's something they've said like, hey, I want to work on like this certificate, or I want this to be a goal of mine now. And then they start talking with me. So then I'll add it to their ISP because then I'll be like, okay, we talked about this, whatever. But then sometimes their goals change. Like specifically if someone got a certificate, maybe they don't they're not working on it anymore. So I might take that out of their ISP, but the old notes was reflecting that ISP that said like, hey, I want to work on this certificate.
So, and Earl, because I know you talked about ISPs, Earl, so I just want to make sure I'm on track here. So what I would think there would need to be a specific, it would need to be documented someplace that the person achieved that goal.
Yeah.
And that's why it's being removed from the service plan. So if they're saying if they achieved it, then you would need to document in the progress note, in some type of progress note, either because you're modifying the plan and you're sitting down and you're meeting with them to modify the plan, or you're just kind of removing it. You would need to document like, hey, went out to meet with person, was told person received their certificate, meaning that they achieved their goal to, get this certification, et cetera, et cetera. Earl, was I on point?
Yeah, you're spot on, because if you remove a goal, you have to have a rationale for doing so. And that has to be either the person achieved that specific objective, or the person expressed an interest, either they no longer want to work on that goal for a specific mitigating concern or whatever. I think what's important to note here is that when we're talking about the progress note, we're talking about a progress note for a specific intentional service. So it's not just general, any progress that person is making. You're talking about documenting that specific episode of service and the progress related to the intended service that is being provided, because you can really get into writing so much that you lose sight of what was the intention of that specific intervention or episode.
Okay, thank you.
You're welcome. The other thing, just to kind of piggyback off of what Earl said, because I appreciate you kind of bringing it back there, Earl, in the sense of like, we're talking about this intentional service, and that's the point of the progress note, right? You're documenting that you went out to meet with that person for such and such thing. There could potentially be other places within your electronic health record to document other things. There might be an unbillable note. I want to say that in the electronic health record that we had like clinical consultation notes, I want to say is what they were called. But basically, if we met as a team and we discussed an individual and certain topics came up, we would kind of document it there as well. But there could potentially be other places where things might be documented just to make sure that they're there, but aren't necessarily included in that billable note. Earl, did you have that too?
Yes, we did, because the challenge particularly with Medicaid, is if you document some progress or lack thereof related to something that is not you're currently working on, Medicaid can always say, you didn't include that in the assessment in the service plan, and therefore you can't bill for this particular episode because it doesn't relate to your service plan. So you have to be very careful what you're documenting relating to that episode.
Okay. Thank you, Earl.
Sorry, just to give context, I'm in support of employment, so that it does have something to do with like what I do, which is getting people jobs. But I hear what you guys are saying.
At the very least, and this is why we talk about the golden thread so much, is you do want to make sure that there is that connection between that assessment, the goal, and the progress note, or not the goal, the ISP. But that's why you want to make sure that if the plan is changing in some way, or an objective is being removed or what have you, that it is being documented. Because if not, Medicaid can come out and say, well, what happened to this goal? Where did it go? And then they're looking for documentation as such. So you just want to be mindful of that, Krista. Okay. Any other questions before we keep going? All right, if anything else comes up, feel free to ask. That's what we're here for. And we appreciate your questions. So this is an example of what a progress note might look like. And again, it's an example, okay? Your progress notes might look a little bit different, but this is just a general example, okay? So the goal, right, corresponds with the goal from the treatment plan. The intervention, they're directed by the goals and objectives. Interventions include activities or support provided toward the goals and objectives. The location, in the community, at a location convenient for the individual or in the office. The response to the intervention, this is where you're descriptive about the results of the intervention, other barriers, or description of how symptoms or functional limitations affected the intervention or progress towards the goals and objectives. Now, in thinking about those different components, all of this is the data. Okay, so the goal of the intervention, location, all that information would correspond to the data piece of DAP or DARP or DAPE and kind of that goal piece, right? The assessment would go in the response to the intervention, okay, as well as the plan. And then the signature with title would go here, okay? So now I'm going to give you all an example of what a progress note might look like, okay? So we're talking about Ralph again. We're going all the way back to Ralph. So you meet with Ralph for your regularly scheduled outreach, and we're going to see how you documented the encounter, okay? And what I'm going to ask you all is, what's wrong with it? That's what I really want to hear from you, okay? So what is wrong with this progress note that I'm going to show you? So you meet with Ralph to work on his goal, focusing on the intervention of him attending a biweekly education and training session for 30 minutes on the role, rights, and responsibilities of the tenant and landlord. Ralph discusses with you how his symptoms have been this week, and what has recently been causing him to feel stressed. You provide education to him on what his role is as a tenant and some responsibilities. Ralph wrote down some questions you both were unable to find answers to. And then during the next session, you're going to review his tenant rights and call his contact at Washington State Housing Authority to have his questions answered. Okay. So how would we fill this in? Okay. So the goal is to find an apartment within walking distance of his parents' home while learning ways to manage symptoms of his bipolar disorder in the next 3 months. Okay. Then you have the intervention. And the intervention is Ralph will attend a biweekly education and training session for 30 minutes given by so-and-so on the role, rights, and responsibilities of the tenant and landlord. Okay. So this would be the location, right? You would add in that it's in the community. And then this would be the response to the intervention. So this is what I came up with as the response, and then the signature and the credentials. Okay, so let's read this response to the intervention. So writer met with individual for his biweekly education and training session for 30 minutes. Ralph voiced having difficulty managing symptoms of his bipolar disorder this week. More specifically, his stress levels have increased, which has caused an increase in the depressive symptoms he experiences. Additionally, Ralph stated that he has been thinking a lot about his previous eviction and is concerned about his role and responsibility as a tenant. Writer used handouts from Washington State Housing Authority to educate individual on his role as a tenant in an apartment, as well as some of his responsibilities. When he had questions, writer and individual collaboratively reviewed the Washington State Housing Authority website, and if he was unable to find an answer, he wrote down the questions. Individual reported significantly reduced levels of stress, as he stated he feels more informed about his role and responsibilities. During the next biweekly session, writer and individual will review his rights as a tenant and call his contact from Washington State Housing Authority to have his written questions answered. Okay, so what do you all think about this note? What are some good things about this note? What are some things that could potentially be changed or rewritten? What do you guys think? So can you clarify, Steph, what you mean by they're not addressing what Ralph specifically voiced, instead only focused on their goals with the client? So you said Ralph mentions that he is struggling with MH, but the rest of the note only discusses the housing goal. Providers should have addressed mental health concerns, provided resources, and then continue with housing. So part of what's missing from this note is that piece where the staff person, how the staff person addressed, like you said, these one or two sentences here, right? So he said he voiced having difficulty managing symptoms of his bipolar disorder, specifically his stress levels, and that he stated he's been thinking a lot about his previous eviction. So yes, absolutely, right? So no, absolutely, right? So we're addressing here, and we're talking about here, and what's being documented here is that Ralph had some of these concerns, but there's nothing here indicating what actually happened and how the staff person, what the staff person did to kind of support Ralph with what he was voicing. So that was a really good pickup, Steph and Connie. Thank you. And that could have been, and just to kind of clarify, right, that could have been done in a lot of ways, right? So maybe it was more about ambivalence. So that's something that could have been mentioned, or it could have been absolutely what you said, Steph, in terms of like what resources were maybe provided. Maybe it's about making an appointment with a provider. Maybe it's about like in terms of like maybe the person has a therapist and Ralph making another follow-up appointment to see their therapist. So that was a really good pickup, Steph. So Patrick, you said, what did he feel he learned? Was this a positive experience for him? Was there enough time for Q&A? And was there advocacy done with him to ask harder questions of Housing Authority? So I definitely see what did he feel he learned? Because again, I think there's a lot of information here about what the staff person did, right? But there's not a lot about the response. That's what I'm seeing. And in terms of like with the other questions that you have, Patrick, like, was there enough time for Q&A and was there advocacy done with him to ask harder questions of Housing Authority? I could say two things to that. Like one, in terms of asking the questions for Housing Authority, that's something that would probably potentially happen during the next outreach, right? Because they're actually going to call the Housing Authority at that time. And whether or not there was enough time for questions and answers, that might not necessarily need to be documented in the progress note. If there were significant things that came up, then yes, you probably would document that. But if there's just some dialogue around questions and answers, you might not necessarily need to get that specific around that dialogue. Okay. Does anybody else have any other feedback? Is there anything else missing from this progress note? Absolutely, right? Time and date is missing. Yeah, very good. All right, so I'm gonna move on because we have about 12 minutes left and we still have a little bit more to go over. So now we're gonna practice very quickly, okay? So you're meeting with Ralph to work on his goal, focusing on the intervention of assisting him with reviewing available housing options in the community that meet his identified preferences, and to compile a list of information and documents required by housing applications. Ralph discusses with you what has recently been causing him to feel stressed. You collaborate to create a list of units within a 15-minute walking distance from his parents' house. And you also collaborate to create a step-by-step instruction guide of what information he needs for housing applications. Ralph expressed feeling less stressed around searching for a new apartment and will meet with you tomorrow to review information and documents needed to apply an apartment, as well as apply for an apartment. So I want you all, I'm going to set a timer for 5 minutes, and I want you all over the next 5 minutes, I'm going to pause this for a second, to develop the response to the intervention. Okay, that's all we're going to focus on, is the response to the intervention. So we know what intervention he worked at, we know the location, we all know the goal, we know all that information, but what is that assessment and response to the intervention? I want you all to develop that. Okay, so I'm going to resume the recording. All right, so feel free for whoever developed that response to put it in the chat box. So Steph, you said Ralph met with supportive housing specialist, I'm going to say, to discuss Washington State Housing Authority and come up with direct questions for contact. Ralph continues to need support and resources as he manages his mental health interventions, supportive housing response. There's no direct quote from the client, so no certainty on how he feels about their session. It really bothers me that the mental health isn't addressed. I would provide resources to mental health services or the warm hotline and then continued. Otherwise, how does the client know that I am paying attention to their needs? Well, so I think and I apologize if I was confusing, but this outreach where you met with Ralph, their mental health didn't come up other than the stress. So you could have discussed in the progress note what how you address that. So it said Ralph discusses with you what has recently been causing him to feel stressed. So you could have then documented how you addressed that with stress. So it could have been something around discussing coping skills. Yeah, that's okay. But yes, and in terms of a direct quote, you definitely can directly quote any individual that you're working with in the progress note, but you also don't have to directly quote them. I think it's better to directly quote if you can. And I understand why that's something you definitely want to do, Steph, but it's also not something that is like a Medicaid standard that Medicaid is 100% absolutely looking for. Okay. Oh, that's interesting. Okay. So thank you for clarifying that. So yes, if your agency is telling you to do that, you definitely want to do that. All right. So Connie, you said client feels less stressed about searching for a new apartment. He continues to be engaged as evidenced by meeting with you to review the next step of information and document gathering in his housing search. At this meeting, we'll also begin applying for an apartment, which shows him continue to move on in the team process. That's a really good synopsis. And again, I know I didn't give you guys a lot of time, so I appreciate you guys bearing with me. So patient feeling decreased stress on apartment search, having a step-by-step approach we developed together. So the only thing I would say, Larry, is, and I don't know if this was just because it was in the chat box, you definitely want to make sure that you are not using those types of abbreviations just in case. Or if you are using them, to write out patient and then in parentheses put PT, and then writing out apartment and then in parentheses using APT. You want to make sure that you clearly define what that abbreviation is with what it means first, and then use them. And then, yeah, you absolutely want to include those barriers. So thank you, Yolanda. So this is what a progress note might look like. And here's the thing. We can always add information to progress notes. You could always get more specific. And that's why, if nothing else, if you take nothing else away from what I say today, you want to make sure that you are taking enough time to develop the progress note. Okay. The more time you dedicate to being able to document the services that you're providing, the more you're going to remember and make sure that you're including everything, all the information that's needed and necessary. And that's why we definitely recommend using that checklist, because the checklist, will help you to stay on track with what information you absolutely need to include. Okay. And then just very quickly, and Earl, if you could put the evaluation in the chat box, you want to be aware of errors. So you want to make sure that you're focusing when charting, because we are liable even when errors are unintentional. So Medicaid might not take money back if there's an error, but what it could potentially do is encourage the auditor to want to review more charts. And you don't ever want to let a Medicaid auditor review more charts than what they're already supposed to be auditing. Okay. Errors will kind of give them that evidence that maybe they should look at more charts. You also want to review the time, date, and date of service for errors. You want to make sure that that information is correct, because that impacts the billing. You want to ensure that the service date, service type, the duration, staff information, and location are all included. You want to ensure that the intervention reflects the appropriately identified goal. And that, remember that errors can open up agencies up to increased scrutiny, more oversight, and/or repayment. Okay. So this is all we have for you. And it is 2:30 on the dot, or I'll put the evaluation in the chat box. And to that, I want to just say thank you all for your engagement and participation throughout the training. We've definitely enjoyed getting to know all of you a little bit better, and we really appreciate the fact that you all have made this a really successful training series. I think Earl and I are going to do this again sometime next year. So if you do feel called to come back, if you have any questions, feel free to do so. But if not, we hope you have a great rest of the year, and we will probably see you around in some other trainings, because Earl and I are always popping up in Washington State doing trainings.
Yeah, I may be seeing a few of you this afternoon. We have the
Yeah.
learning community for supervisors, but
There you go.
happy holidays.
Yes. Thank you. And I'm going to just stop the recording.